Ladies and gentlemen, thank you for your patience in holding. We now have your presenters in conference. Please be aware each of your lines is in a listen-only mode. You may submit your questions electronically at any time during today's presentation by using the Q&A window located to the left of your slideshow. Directly underneath that window, you'll find a window labeled Resources where you may download a PDF copy of today's presentation. Please also note that we'll be introducing several polls. For your vote to be counted, you will need to click with your mouse on the circle next to your answer. Any submissions typed into the Q&A pod will not be submitted. It is now my pleasure to introduce our first presenter, AHA moderator Laura Castellanos.
Thank you. Hello, everyone, and good day. Thank you for joining us. The American Hospital Association is delighted to host this webinar with HEAL Trafficking in the National Human Trafficking Training and Technical Assistance Center. For today's webinar, the Human Trafficking Response, Resources for Healthcare Professionals, will provide key resources and information on how healthcare and providers can combat human trafficking. We hope this will help in our understanding of practices, policies, and procedures to best prepare, respond, and create system approaches to care for victims of human trafficking. The AHA's Hospitals Against Violence initiative is proud to partner with HEAL Trafficking and Jones Day Law Firm. This past year, we have worked together to bring a series of webinars, like this one, covering a range of topics from legal aspects, labor trafficking, trafficking of children, and more are being developed. We look forward to continuing our efforts and supporting your work. At the AHA, we're committed to raising awareness of this public health crisis and aiding our hospitals and health systems in combating human trafficking. We are very pleased that last year, the new ICD-10 codes for human trafficking were approved by the CDC and became effective this year. We want to work together with all of you to learn how we can best support all of our hospitals and health systems. So during the month of January, Human Trafficking Awareness Month, we have been sharing key resources, webinars, and a special report on how hospitals in the Houston area came together to combat this crisis and continue to advance their work, and as well as resources for the new ICD-10 codes for human trafficking. We hope to do more, learn more from you, and develop resources to support your work. So visit us at aha.org/preventviolence. Now I'm pleased to introduce our speakers for today. Ashley Garrett, Director of the National Human Trafficking Training and Technical Assistance Center, and she has been a victim advocate with almost 20 years' experience in training, technical assistance, and program management of human trafficking victim assistance programs, will be joining us today. As well as Dr. Hani Stakloza, Executive Director and co-founder of HEAL Trafficking and an emergency physician at Brigham Women's Hospital. She's also an internationally recognized expert, advocate, researcher, and speaker. We're delighted to have you both, and handing it over to you, Dr. Stakloza.
Thank you, Laura. Good afternoon and good morning, everyone. And I just wanted to give a special thanks to American Hospital Association for their leadership on this issue. So, as Laura mentioned, I am an emergency medicine physician, and we're going to start off with a case discussion to get us jump-started. Of course, because I'm an emergency medicine physician, the case will be grounded in the emergency department. And I just want to let you know that all of the identifying details, including the names, have been changed to protect confidentiality. So imagine with me that Pedro, this is Pedro, comes into your emergency department, and he enters through the triage area. He's accompanied by his friend Martin, and Martin says, you know, he got hurt on the construction site today. Martin wants to make sure he gets checked out and gets whatever pain medication he needs so we can take him back to work. Martin insists on staying with him and says he needs to help with translation, as Pedro speaks Spanish primarily. So when registration attempts to register Pedro, it's noted that he has no identification. Martin apologizes and says, you know, we forgot to bring his wallet, but, you know, it doesn't really matter. He's new to the area. He doesn't have health insurance yet. So Martin offers to pay cash for Pedro's care. Now, just some details from the triage here. So the triage nurse makes some really important observations as she's medically assessing Pedro. On her screening assessment, the nurse notices that while he works in construction, he appears pale and ill-appearing. And when she goes to check his blood pressure, notices some old bruises on his arm, and that he's really just, Pedro's not speaking spontaneously at all and just avoiding any sort of eye contact. Almost all the questions posed to Pedro are answered by Martin, and when an interpreter arrives and Pedro is asked questions directly in Spanish, he still doesn't really answer most questions, but if he does, he speaks in just a couple syllables. And then if he does answer, he looks right back up at Martin immediately after answering. So for the clinicians who are listening to this story, you know, and for most of us, alarm bells are going off left, right, and center. You've been trained to notice signs of abuse, such as, you know, a companion coming in with somebody, controlling the communication. There's a fearful demeanor on the part of the patient. The story doesn't match the physical exam, including showing signs of old abuse with the old and new bruising noted by the triage nurse. And there are some unique features here, too, that may be more specific to trafficking, such as a work-related injury and lack of access to documents, as well as willingness to pay cash for care. So our vision is that all trafficked persons, like Pedro, who enter the doors of your hospitals and clinics, are given the care they need and referred to the resources they need to break their cycle of exploitation. Our hope is that today's webinar catalyzes the work in your health systems so that you have a beginning framework to set this in motion. Back over to you, Ashley.
Hi, everyone. Again, this is Ashley Garrett. I'm the director for NHTTTAC, the National Human Trafficking Training and Technical Assistance Center. And I definitely also wanted to reiterate my thanks to the American Hospital Association as well as to the HEAL Network for their leadership in this area. And I think the way that we start off this webinar is critical because we are really rooting it in the care of our patients that we're already working with. And so today's objectives are really to provide an understanding of the role of a healthcare professional in providing trauma-informed care and a survivor-centered approach to human trafficking. We are going to talk about the importance of the newly available ICD-10 diagnostic codes and some of the opportunities that presents and some of the challenges that also presents. And then throughout and at the end as well, we're going to discuss available resources, training, and technical assistance for hospitals. So let's go ahead and get started. So for those of you that are newer to this topic, human trafficking is a newly evolving field. We've certainly, in the past decade and a half, since it became federal crime, we've had an increase in the level of research. And I think one of the most profound pieces of research that has started to come forward is the way that individuals who have been trafficked are highly likely to come into contact with someone from the health system. In a 2016 study that's referenced here, over 67.6% of individuals who had been identified and survived sex and labor trafficking noted that they had encountered a healthcare professional during the time they were trafficked, and yet none of them were identified as a victim of trafficking during these encounters. And I think that's a really profound piece because as frontline care providers and professionals, we have an opportunity to engage in a different way than many others that come into contact with individuals when they are experiencing human trafficking. And that statistic came from survivors themselves who have identified that. And there's other statistics as well that really look at that. So let's look a little bit at what your confidence is. So if you all could select just for yourselves, please rate your level of confidence in your ability to identify and respond to human trafficking. This not only helps us in this webinar, but will also help us in future programming as well. So let's see, keep ticking away. Looks like so far we're at about at least 50% are identifying that they have a pretty low or very low comfort level in identifying and responding to trafficking. And then we've got some great experts in the call as well. about 30% looking at high, and another 15, it's about 40 to 45% that are saying high or very high. And I think that's really indicative of a lot of the work that we're doing with NHTTAC and HEAL and AHA, where there is a growing expertise in the community about how to respond to this. And so what we want to talk today is build off of what those experts, including those of you on this call, have already been learning, and help to spread and share that information so that we can go forward in more robustly responding to our patients' needs. So I'm going to go ahead and end the poll, and we will, I think you guys should have been able to see those results, so I am going to go ahead and keep us moving along. So one of the other things is that there's been some research looking specifically at healthcare professionals and who they're encountering. So this graph is based on an anonymous national healthcare survey completed in 2014. There were 117 individuals who'd been trafficked that responded directly to this survey, and they experienced both either sex or labor trafficking. Now, one thing to note is that it's important that many of these patients saw multiple providers, which is why the percentage totals here don't actually add up, or they add up a little bit over to 108%. So as you can see here, individuals being trafficked most commonly encountered healthcare providers working within the emergency department at 55.6%, followed by primary physicians, then dentists, and OBGYNs. One thing to keep in mind about this survey is that this specifically did not look for mental health or substance use treatment points of contact, and only adults participated. So things like the pediatrician's number are probably underreported, and then certainly mental health and substance use disorders treatment providers are definitely areas in which we often see survivors come forward to seek out care. And I think it's important to realize as well that when you look for how they're coming forward, they may be coming forward in the context like the case study that Hani shared, where they're in the midst of experiencing the exploitation and are in someone else's control, but they may also come to you either prior to and are showing high-risk symptoms of where they might become vulnerable to human trafficking, and also considering that while this crime has been going on for many, many, many years, the federal legal definition wasn't passed until 2000, and so you have people who may be out of their situation and may have been out for years that are experiencing the consequences of the exploitation that they had prior in their life. And this is really where healthcare and behavioral health practitioners really can come into play and more fully respond to their patients' needs. So a few things that were really indicative in the case study that Hani shared are some of the 10 red flags that your patient could be a victim. And this, again, is a resource that's available through AHA. It's something that you could definitely share and have posted in places throughout your clinics and hospitals. So just as in the case study where what is being shared in terms of what the patient is presenting at and what their oral history, and there seems to be a conflict between the two, that things are scripted or they're mechanical, or somehow there seems to be a lack of information that is being shared. Certainly observations around fearfulness, anxiety, submissiveness, hypervigilance, and paranoia are often signs that someone is being concerned. And as with many of our work in other types of violence, particularly family-based violence, where someone seems to be exerting control over the visit and the flow of information and the resources available. So one thing also is that, and especially in the climate right now, patients can express a lot of concern about being arrested or jailed, both from police but also from immigration, and that they may express concerns or appear to be fearful for their family's safety. There's, again, kind of looking back at that case study, that there's evidence that shows a history of trauma that maybe doesn't fit with the context of the story in which the person is sharing about their circumstances. In many cases, we're starting to see this is definitely common in sex trafficking, but also in other forms where tattoos or there is an unfortunate branding of an individual that seems to indicate ownership by someone else. And then certainly particularly in labor trafficking, but also in sex trafficking cases, the occupational type of injuries or physical ailments that linked to their work, as well as both with, I think one of the things with sexually transmitted infections there's often a misperception is that sexually transmitted infections are only indicative of sex trafficking when in fact many survivors of labor trafficking have also experienced sexual violence. So what do you do about that, right? So these are great red flags, but I think it's really important to think about how do we, and in the context of a clinic or an emergency department or a hospital, our staff have a lot that they have to assess and triage about a wide variety of things, both from the patient's health symptomology, but also then looking at the circumstances of the other ways in which we need to be assessing for a variety of things that do include human trafficking but are not exclusive to human trafficking. And so we think within your own organization, it's important to be proactive in creating a protocol for responding to human trafficking. And the components of a protocol within the healthcare system should, at a minimum, address preparing to respond to trafficking, identification, and then what do you do to when you identify victims and survivors of trafficking. And so I want to talk a little bit about what each of those are. With the time constraints we have in a 1-hour webinar, please know there are a variety of resources and additional trainings that can really help you dig into this further. And that this particular, there's a great resource that HEAL has developed as well called the HEAL Trafficking Protocol Toolkit, which is where a lot of this is also pulled from. So when we talk about preparation, clearly a huge part of preparation is helping to educate your staff. You cannot identify red flags if you don't know what they are. You want to think comprehensively at the type of patients that you are seeing and where your organization may already be interfacing and providing services to individuals that have a potential to be a victim or survivor. There is a growing wealth of networks and anti-trafficking organizations throughout the country, and getting engaged in that in your own communities that you are working in helps you to become more informed about how trafficking is working in your country. And then certainly developing a resource directory where, as you identify needs of patients, how do you start to identify a referral network where you can share and provide referrals to things like substance use, dental care, shelter, and et cetera. And then certainly as you engage with the communities in your health outreach, I think certainly outreach and engagement strategies to populations in your communities that are particularly vulnerable is important. When we looked at the questions that many of you sent in, and thank you for that, there were a lot of questions about number 2 in here, which is around identification. So trust me, between Hani and I, we could probably speak for many, many hours about how this works and strategize with all of you on this. But I think one of the things that's really important when you think about identification is who you're training. So it's important that you're training clinicians and individuals who have a responsibility for the care of a patient, but it's also just as important to be training folks like your receptionist or your front desk staff, your janitorial staff, or your security staff. Because in each instance, they have an opportunity to observe behavior that can indicate some of the red flags that we talked about earlier. Clearly identifying a separation protocol prior to doing any screening or identification efforts is really clear. As you can see from the case study, if that had been done and there was an interpreter involved, then maybe more information would have been able to be obtained from the patient about what was really going on. Interviewing and screening is an important skill set And to do that in a trauma-informed and survivor-centered way requires specialized training. And so how do we think through that, and how do we make sure that we're training up the staff and have the process in place to understand how to do that effectively, while also making sure to consider the safety, both of the general safety of the individual and the trafficking-related ones, as well as for your own staff and your facilities. It's critically important that when you start to consider identification and screening, that you absolutely have a response to then what. We definitely don't want to talk about screening and identification if you don't have an ability to, once you screen and identify someone as likely yes, you don't know what to do in response to that. So things under response include approaches towards mandatory reporting, confidentiality, different resources around, again, how are we going to provide treatment, and that doesn't include just within your own organization and system, but also looks at organizations outside of your organization. There's a lot of other different pieces in there that are involved, and we have several resources at the end that are both trainings as well as resources in developing some of those response processes and protocols. So let's get some more feedback from all of you. Within your organization, how many of you have a current human trafficking policy and or protocol that address, and please check all that apply, screening, referrals, reporting, and clinical health care? And this is specific to human trafficking. So it could be that it's embedded within other protocols that you have and policies, or it is separately created. Okay. All right. So it looks like amongst folks that are identifying where they have protocols, the top markers tend to be around screening, referrals, and reporting, which is pretty indicative of the healthcare field as a whole right now. I think one of the important parts for us is to think about how to do the baseline education around some of these things, so then we can increase our understanding and knowledge about the clinical care side of things. So I'm going to go ahead and close that poll and very quickly keep moving us along into the basic education. So in many ways, think of this slide as a checklist. So when we talk about everyone in your organization who has an opportunity to observe and or interface with your patients, you do want them to have the basics. And so we want to make sure that all training is inclusive of all forms of human trafficking. Many tend to focus solely on sex, and it's really important that we recognize that labor trafficking survivors are coming to see us in high numbers as well. Understanding who are the at-risk populations, learning directly from survivors about what they experienced, both in terms of their trauma, but more importantly, their experience in interfacing with you and your counterparts as professionals. What are the different basic roles and responsibilities? People have different roles and ways that they should interact. And then what is your crisis response within your institution? I think one of the things we've developed at NHTTAC is a SOAR training that's available online and is accredited for folks to really provide that baseline training that everyone can receive CEs and CMEs if appropriate, and can really address those basic foundational pieces. And then by doing that, you then need to expand into more of the extended education essentials. So what does it actually mean to practically apply a victim-centered care and trauma-informed care approach? Are there different approaches to screening if we're looking at child sex trafficking victims that are U.S. citizens versus adult labor trafficking screening for a foreign national? What are the in-depth internal protocols? And we really want to apply that this piece is really not just about a knowledge base, but we're also really looking to expand the skills and change attitudes and behaviors so that they can best serve the patients that they are working with. Okay, so let's learn a little bit about your organizations in terms of who provides training for staff on human trafficking, and is it mandatory, voluntary, or there is none? And again, there will be lots of resources available to all of you to help in addressing wherever you fall into this category. So don't be concerned. We'll be letting you know where to go for more support on that. Okay, so far it looks like about, on average, about 50% of you have no training available to staff, and then some, about 33% have it, but it's voluntary, and less than 20% are providing mandatory level training. I have many other questions, but we don't have enough time to dig into that. But I think that really says, in as much as we want to continue to make sure we are taking care of our patients fully, that we are considering the ways that we can educate our staff to do that. So now I'm going to turn it over to Hani, the clinician, to talk a lot more about what this means from a care and documentation standpoint.
Great. Thank you, Ashley. And yeah, it's interesting on that last question to think about those that have it as a mandatory requirement. If those folks are in states where there is a requirement by law to for recredentialing, in some cases, for health professionals to have training on trafficking. So yeah, it'd be interesting to break that down. All right, that's the researcher part of my mind going up. But so this next portion, we really wanted to provide a framework for thinking around documentation, electronic health records, and the new ICD codes. And again, with all of these, in many ways, this is a teaser. We want to give you a framework for thinking about this, give you some next steps for resources, but we could talk about any of these topics in great detail, and they could each be their own webinar. So first, to start off with documentation. So a question that comes up quite frequently in building organizational level responses to trafficking is, what is the advice that we should be giving clinicians around documentation of suspicion of human trafficking, confirmation of human trafficking? And so just to kind of go over some general things to think about in this context in terms of just purely the documentation piece. So first is to remember, as we all know, that the medical record, of course, is for medical care and for communication among clinicians, among providers, to really serve our patients best. And we also know that it can serve a legal purpose as well. And because of the particular complexity of medical legal issues around human trafficking cases and the great variation in state and local laws, we really recommend that as you're developing guidelines and optimal documentation practices regarding trafficking, you should do this in consultation with local prosecutors, defense attorneys, advocates who know that local legal landscape best. And depending on the legal climate, entering more or less information into the patient's chart can be either harmful or helpful. And just to give one very quick example of this is, in some states, the transmission of HIV is criminalized. And so if a sex trafficking victim happens to contract HIV, that may put them at risk of being criminalized for having that HIV. So that's just one example, and there are many more that I could give. And then in terms of general principles, as clinicians are documenting, what we look to for guidance in this is really guidance that we know that's longstanding in terms of sexual assault and documenting child abuse as well, to very objectively state the patient's history and physical findings. On the history side of things, really keeping the details to what is necessary for medical treatment, so not to go into a long, detailed narrative about what was said was happened, but just as it's relevant to the medical care itself. And then to document physical findings objectively, and in some cases it may be indicated to document forensics imaging, of course always with the patient's consent. So we are very pleased that, as Laura mentioned at the beginning, that ICD codes were approved by the CDC last year. And AHA has led in this and has, under your resource guide that accompanies this webinar, you can access the AHA guidance for coders on the new codes. The codes are available for data collection on adult or child forced labor or sexual exploitation, either confirmed or suspected. I imagine in most cases it will be coded as suspected. And these new codes, which drew support from other hospitals and health systems, may be assigned in addition to other existing ICD-10 codes for abuse, neglect, and other maltreatment. So while the human trafficking codes are new, as many of you know, we've had codes for other forms of abuse for quite some time. In addition, the new codes are available for past history of labor or sexual exploitation, encounters for examination and observation of exploitation ruled out, and an external cause code to identify multiple repeated perpetrators of maltreatment and neglect. So more details can be found on that information sheet, and that was just a screenshot of it there for your reference. So as mentioned, there have been billing codes for other sensitive issues that have preceded human trafficking. So as a field, in the day and age of electronic health records, how do we establish guidelines around human trafficking knowing that we have these new codes? And the short answer is that we're looking to well-established fields that have dealt with issues of documenting on these sensitive topics in the age of electronic health record. And the next two slides are briefly going to cover some guidance that came out of the Society of Adolescent Health and Medicine, which I think really can form a roadmap for how we think about this in the trafficking context. So these first 3 points here are related to privacy controls. So for some patients, based on maybe prior diagnoses that are already coded in a given chart, there are default settings that are related to privacy, or certain clinician notes, for example, psychiatric care, may fall under default privacy settings. And then there's always some element of allowing the clinicians to use their discretion. So maybe somebody comes in and there wasn't initially any concern for abuse or violence or trafficking, and then that is identified, and so there needs to be a higher level of privacy control for that particular visit and for those and for the patient's chart in general. Clear on-screen labeling of confidential data elements. So making sure that, just like with anything else, that the signals that are sent to the clinician as they're taking in multiple inputs in their clinical care of all of their patients, that the ones that are related to privacy are clear and easy to use. Built-in abuse privacy-related decision support tools. So there are some systems in the United States that are already doing this related to trafficking. Both in terms of the privacy-related piece as well as using the electronic health record really as an aid to help in the screening process. And then, of course, we know part of what comes with the day and age of electronic health records is patient portals, and thinking about how we can, both on the health system side as well as the patient side, knowing that some of those patients maybe have experienced abuse, make sure that that abuse is not disclosed to those that may do harm with that information. So just some final points here, and this kind of goes through the chronology of clinical visit in terms of suggestions here, but thinking about, you never want the scenario where a billing code related to somebody's disclosure of abuse to show up in the mail and potentially for a perpetrator to open that. So the suppression capabilities for this are established for other forms of abuse, and so we look to that, those technologies as it comes to trafficking. And then really coming together on a national level to make sure that all stakeholders, including payers, are aware of the new trafficking codes, and that we can work together to make sure that we're able to balance clinical care along with privacy for our patients. I'm going to hand it back over to Ashley.
Okay, so as I think we've all kind of mentioned, I think we're really interested in using this as an opportunity to really leverage the relationship that AHA has with each of you to better inform where your needs are in terms of providing additional training and resources. So we wanted to ask a few more questions to you all to kind of solicit that input, to give us some of that so that we can use that to inform our next steps that we work on together. So let's go ahead and open up the next poll, which is looking at, have you done any of the following? Again, check all that apply in addressing human trafficking in your organization. So for those that have started to do work in this area, what are some of the things that you have been becoming involved with? So I love to see the high percentage, almost close to 60, 70%, looking at really further developing their skills and knowledge about serving their patients who are also victims of trafficking. Looks like some really strong interest in and applying how do I advocate or champion this issue within my organization to impact change, so that we can really look at improving our programs and practices and incorporate victim-centered, survivor-informed care. One thing you'll note is that we use the term survivor-informed a lot. I think as we've learned from other, working with other patients of other vulnerable areas, that it is critical that our patients are helping to inform us along the way. And so there are a lot of really wonderful resources that are informed and developed by survivors. For us, I know for us in NHTTAC, we don't develop anything without paying for survivor experts to contribute to those, and I think that's a really important thing. So that's really helpful. I mean, it looks like the most area that folks are really involved in is building up their own skills and knowledge, and then a little bit less so, but still with some really good percentages looking at how to actually transform your organization. So let's go ahead and do the next poll. So when you think about the history of how people have responded to human trafficking, we tend to focus much more on the criminal justice response. So we want to assess where you're at in your level of confidence and your ability to apply a public health approach when responding to human trafficking rather than a law enforcement or criminal justice focused approach. Okay. So as we look at this, I'd say we're about 50-40, 50-50 in terms of understanding that either I'm high or very high in my confidence around this, or very low and low. And that's also really indicative of what we're seeing across the United States. And so certainly emphasizes the importance of trainings and conversations that we're having here, and the commitment we need to continue to have that also do that. Okay, let's go ahead and do what I think is the last poll for you all before we get into questions and conversations about additional resources, which is please rate your level of confidence in your ability to use trauma-informed practices when responding to trafficking. Again, it looks like we're kind of coming to a split. Slightly more than half are really talking about feeling like they've got some comfort level in using that to understand not what is trauma-informed by the description of principle, but how do we actually apply that in the context of working with our patients. And there are, one of the trainings that we have with SOAR is specifically targeted just on trauma-informed practices, and another one we have is specifically looking at culturally and linguistically appropriate services. So on that note, I think that was really helpful. Thank you so much in being willing to kind of give us some insight in terms of where you're coming from. I know that we wanted to take that as a chance. Oh, sorry, I just got pinged that there is one more poll left that's specifically looking at, so let's go ahead and do that one too, looking at your confidence in being able to apply culturally and linguistically appropriate practices. And keep in mind that when we talk about culture, we don't just mean we're talking about ethnic or racial or cultural, like what we consider traditional cultural things. We're also looking at the ways, the geography of where people are coming from, their community that they're coming from, their sexual orientation, all of their gender, all of those contribute to understanding cultural and linguistically appropriate practices. So, and again, about a 50-50 breakout between folks that are low to very low and high to very high. So thank you for that. And I think I'm going to turn it back over to Laura to take us through some of the questions that you all have been sending in. Thank you so much.
Thank you both. Wonderful presentation. Definitely want to just highlight the fact that resources are available. There's a resource page you can download. The links are written out. You can print it, share it. We just want to make sure that you have an accessible document. I also want to make sure that you are posting your questions and answers. We'll take some from the ones that were previously shared with us. We won't get to all of them. We'll definitely get the ones that we're getting live. So just want to start off by asking, do you have policy guidelines that other healthcare organizations may use to assist in development of policies?
Honey, you want to start?
Yeah. I was reading the questions on the side too. Yeah, so in conjunction with survivors and experts in the field from a variety of disciplines, HEAL Trafficking launched our HEAL Protocol Toolkit, which is really a roadmap for health systems that are trying to figure out how they're going to develop their policies and procedures. So it goes from A to Z, from internal and external stakeholder mapping all the way to monitoring and evaluation. And a colleague of mine said the other day, this is something that a hospital administrator, a trauma surgeon, a nurse, anybody can take and pick up and really figure out where to start and how to get going on this. It's been downloaded now in over 26 countries in all 50 states in the District of Columbia. So we're seeing a lot of positive input as well from stakeholders, and just like a lot of hunger for that resource. It's included in the packet resource packet from today's webinar too. So just click on that link.
And I would say, this is Ashley, I think one of the things we've been doing is kind of trying to identify where there are resources like the protocol toolkit that HEAL has developed, and then how do we build training around that. And so one of the areas, you've heard me mention our SOAR training, and we have a few different ways that we provide that. But one that's really specifically targeting organizational change is our SOAR for organizations. And that is a cohort-based remote learning where we work with champions and leaders in the organization that are looking at actually applying and building that framework. So everything from talking through and learning more from each other, as well as the experts delivering the training on how do I assess where our organization and our patients are already vulnerable or experiencing this, to what do we look at from our education and our protocol policies and procedures, and how do we continuously measure that impact and assess, as well as connect to the community that we need to connect with in order to more successfully work with that. So I think that is a resource that I would definitely flag for folks that are champions within their organization and looking to be able to tap into more resources. Hani happens to be one of the instructors on it, and so that's another place to look as well.
Thank you both for that. Moving on to the next question, what are some ways to better inform your community about human trafficking?
I can jump in here.
Yeah, you go.
Oh. We'll just tag team it. So I think it's always helpful to look outside of your hospital walls, your health system's walls, and that's what this question is getting at. So I really love that. I know that as we approached how we were internally in the hospital going to approach trafficking, step number one was to really understand and learn from the expertise of the organizations that have been working in our community for years on this issue, social service providers to law enforcement, and to better get a finger on the pulse of what trafficking looked like in our community. And then as that makes sense, to also be able to feed that back to the community. But the first step is to really learn from those that have been doing the work, including engaging the survivor leaders in your area. Ashley, go ahead.
Yeah, I think those are really important resources. If you actually go to our website, there's a couple resources that I wanted to specifically highlight under NHTTAC. If you go into resources, One of the things is that there is a series of outreach materials that the Office on Trafficking in Persons has already developed. They're free of charge, they're downloadable, and there's a whole series specifically targeting healthcare providers. That's called Look Beneath the Surface. So that's a great tool if you want to start reaching out and engaging both internally and externally. The other thing is if you don't know who's doing what in your community, if you go to and you look up, we have state and territorial profiles that are available in English and Spanish that have pulled some of the information about each state that comes from the National Human Trafficking Hotline. And we also identify any legal context that's specific to that state, as well as different resources and organizations. And then the final tool is there are actually quite a few, there's over 100 service providers that are receiving federal funding specifically to support human trafficking patients and clients. And so if you go, again, by going to the NHTTAC site and look under resources, there's a funding map, and it'll tell you exactly who's in your community, and you can reach out to them directly.
Thank you,
Lara.
Thank you. Next question. Where can you obtain training on trauma-informed interviewing?
That is a great question. So one of the things, all of the SOAR training that we do, whether it's the foundational online training that we offer or it's the training on organizations or communities, we incorporate trauma-informed training. We also, however, so there's sections on that embedded within because it's a core part of all the training we do. There is also a module if you're just getting started and wanting to understand more about what trauma-informed means, then you want to look for that trauma-informed care module. And then we're actually specifically targeting one of the audiences that we've been really working with closely are sexual assault nurse examiners who are doing a lot of trauma-informed interviewing in health systems, and we've got some great training resources that we're delivering in partnership with the International Association for Forensic Nurses. I would say as well, just locally, reaching out to your child advocacy centers and entities that are already knowing how to do trauma-informed training and helping them to understand, if there's not already, why becoming informed about human trafficking is a critical piece of where they need to grow their skills. And there's organizations like the National Child Advocacy Center that are also doing some of those trainings for those types of practitioners. So those are some places to start. And then it looks like maybe, Laura, was there a follow-up about what is the website on what is happening? So if you go to the resource that I talked about figuring out where to start in looking at what's happening with your community, if you go to the NHTTAC resource that's on your resource page and click in there and then go to the resources section, if you want to look at the two terms you would want to look up are state and territorial profiles, and then I believe if you just put in map, you'll be able to pick up that federal funding map as well. I will say as well that if you go to the National Human Trafficking Hotline, which is also on that fact sheet for you, they also do state-specific reports. For those of you unfamiliar with the hotline, it is the federal hotline on trafficking, and they're also a great resource. You can reach out to them, and they can help also connect you with people in your community so you can get involved in knowing who's already doing this work and how you can complement and augment the work they're already doing.
Thank you. Yes, so their next question is, what is the best approach for a client suspected of being a victim of human trafficking?
I can start off with that one. Yeah. So this is a great question. And thank you all for these questions. This is going to be the beginning of, I think, many conversations in your health systems, and thank you all for being here today. And my hope is that we create, if not further catalyze, the championing that you're already doing. So if someone, let's say, if we go back to Pedro, there's a high suspicion that there's some sort of abuse going on for him We really look to the domestic violence world to understand the approaches that we take with potential trafficking victims in the emergency department. So the first and foremost thing is to ensure privacy and having a further conversation, to really give a moment where they're one-on-one with their health professional. So if we go back again to the Pedro's case, I would use, I have a toolbox of excuses to get a patient alone. One is to walk them to get a urine sample, or to order a radiographic study like an X-ray, and use that moment in a way that doesn't tip my hand to the person who may be minding them or the companion that comes with them. Have a private conversation and assess further about what may be going on in terms of potential trafficking or other forms of violence, and then it's assessing what their needs are. So in the case of Pedro, he is a foreign national. He may have a fear of deportation, and documentation status might be something that he needs. So he may need to access legal services. But I would ask the patient what their needs are. There may be a need for housing. Again, patient-centered approach, trauma-informed approach, to allow them to guide where the rest of resources that you're able to connect them would go. And this is why we are so excited about this conversation today, because what we want to happen is that in each and every one of your hospitals, each and every one of your clinics, that you have that plan in place. Your resources are going to be different in each and every community. The providers that you work with in the community to help connect victims and patients with resources are going to vary. And so we're really hoping that as a result of this webinar, you go out there and create the policies and procedures so that you have that plan in place. You know who you're calling at Saturday at 2 a.m. If you identify a labor trafficking foreign national. So that's just sort of the high-level piece, but also to kind of put it back on all of you to go out there and create your policies and procedures.
I would say, too, I think that if there's a place where you want to kind of start looking at what's the environment that's appropriate to create, I mean, certainly we've talked about some of the training resources that are out there. We also developed a survivor-informed, a screening toolkit on human trafficking, and it both talks about what is the environment in which screening needs to be done in, and then what are the questions that you want to ask. And that really pulled together so there is a variety of different tools out there for screening. Very few have actually been validated. And there's actually a discussion going on within the community right now on some of the different approaches to screening. I would say your most validated screening tools tend to be for child sex trafficking victims. So one of the things that toolkit does, though, is it provides you with all of the literature that's out there, or was out there at the time that we developed it, on both screening around human trafficking, but we also pulled from domestic violence, from HIV/AIDS lessons learned, and then we worked with survivors and clinicians who are experts in this area to develop the approach. And so it really looks at what do you need to have in your organizational environment, and then provides a very short list of questions that you want to be thinking about. So I think that's an important thing to keep in mind. That is an area of the field that is clearly evolving, and I think it's exciting to see some of the different research and validation that's going on. Hani, did you want to also add in on that?
Yeah, I think we're going to see a huge cultural shift in healthcare around screening for violence and abuse, including trafficking, over the next couple of years. I know that on my own personal level as an emergency physician, my practice has completely changed as I've delved into the domestic violence literature. And, just to give you that perspective, as an emergency medicine doctor, I screen for lots of medical things, right? So if I want to find out if somebody has a heart attack, I do an EKG. If I want to see if somebody has an electrolyte abnormality, there's a blood test to go look for that. And so I think the cultural shift that we're going to see is that we realize that even if we're using the word screening, that we're really talking about creating the conditions for disclosure and a conversation where all of our patients feel that they are understood, that they don't feel judged, that we're looking them in the eyes, and realize that those things are much more important in terms of creating that environment for potential disclosure than anything else. But it's not like, oh, this person in front of me has this problem going on. If I ask this magic question, it's all about the question, that they'll somehow, forget about the fact that somebody's threatening deportation, or that somebody's going to hurt my children, or all of these other things. So to really help clinicians to think about this as a totally different skill set, which we're empowered to do, and that success might also look different, that a positive outcome, that the outcome we're looking for is that they feel safe in our health facility, that it's not about disclosure, that it's creating that open door. So I think we're going to see a real sea change in the way that we're talking about this, and I think it really aligns with where we're hearing from our patients that they're coming from.
Thank you, Hani. We have just a couple minutes left. I know there's a few questions on the screening toolkits. It's all on the resource page. This webinar will be posted, the recording as well as the presentation deck is also downloadable. Just want to make sure that if there's any questions, you can also feel free to reach us at hospitalsagainstviolence@aha.org. The presentation deck also has Hani and Ashley's email address. I just want to give Hani and Ashley an opportunity to say any last few comments, and then we'll be closing the webinar. Hani, Ashley, anything?
Sure.
I'm really
always.
excited to see where this conversation goes. We're excited to continue to engage all of you. I see you all as champions in your health facilities and health systems and clinics, and let us know how we can be a resource.
Yeah, this is Ashley. I completely reiterate that. Our mandate, so NHTTAC is the TA provider funded through the U.S. Department of Health and Human Services Office on Trafficking in Persons, and our whole mandate is to support you and walk beside you in being able to more meaningfully address this issue. And all the resources that we offer are free, so I definitely, if I saw a few questions saying, oh my God, I don't even know where to get started, we don't have anything. Well, you do. You have these resources that we've just given you as a starting point, and you have us to partner with and to reach out to support you as you move forward. And so for some it can feel a little overwhelming at first, but it's kind of a step-by-step, and there's lots of ways to get informed and to get engaged, and you're not in it alone. So please definitely reach out to us and see how we can be supportive.
Thank you both for your closing comments. Thank you again for joining us today, and that will conclude our webinar.
Ladies and gentlemen, that concludes today's presentation. You may disconnect your phone lines, log off your webinars, and thank you for joining us this afternoon.